would like to thank Coca 2005 and Jamal. You both sent the story practically at the same time. 6 children dead, 12 ill in virus outbreak at New Jersey facility. And I will leave the link to this article in the description box. Let me go ahead and play this video.
6 children have died because of a flu-like virus at a medical center in New Jersey, and 12 additional child patients, we're told, are infected. The outbreak is happening at a facility in Haskell, New Jersey. CNN's chief medical correspondent, Dr. Sanjay Gupta, is with us now. So, Sanjay, what more do we know about this outbreak?
Well, we know, first of all, that the Department of Health is on site right now at this facility. So they're investigating this. They were there over the weekend as well. This particular center takes care of longer-term patients, rehabilitation, as you mentioned, but also has a pediatric center. So it does both long-term care for elderly people as well as a pediatric center. And we know that 18 patients within that pediatric center tested positive for adenovirus. As you mentioned, it's a flu-like virus, but it's not the flu. It's a different virus. It's typically something that can occur year-round, and it can be very contagious. So of the 18 patients who tested positive, as you mentioned, 6 have died. What we don't know yet, Erica, what we're trying to find out still is over what period of time did this occur? Was this over days and weeks, or was this more over hours and days? And also, the children at this center are what are called medically fragile children. Typically means that they have a significant dependency of some sort. Sometimes they're on ventilators. Did they stay in the center, or when they became ill, were they transferred to hospitals? We're still trying to get some of those details, Erica.
Wow.
Retired Supreme Court Justice
Wow. All right, y'all. I tell you, it's so many things going on right now. It's not even funny. So as you heard in the video, 6 children have died as a result of adenovirus. And this was in a Wanakay Center for Nursing and Rehabilitation in Haskell, New Jersey. 12 additional pediatric residents at the center have been infected, according to a statement from the New Jersey Department of Health. Wow. So the Wanakay facility has been instructed not to admit any new patients until the outbreak ends. And they are in full compliance, according to the health department. The health department was notified of respiratory illness at the center on October 9th. The timing of the deaths is not clear. The exact ages of the children are not being released to protect patient privacy. Nicole Kurgan, a spokeswoman for the Department of Health, said, adding that the age ranges for the deceased children was from a toddler through young adults, but most are under 18. The New Jersey Department of Health said it's an ongoing outbreak investigation and workers were at the facility Tuesday. A team at the facility on Sunday found minor hand washing deficiencies. Adenoviruses can cause mild to severe illness. Through serious illness is less common. People with weakened immune systems or existing respiratory or cardiac disease are at higher risk of developing severe illnesses from the adenovirus infection, according to the Centers for Disease Control and Prevention. This outbreak, caused by the adenovirus type 7, is affecting medically fragile children with severely compromised immune systems. The strain has been particularly associated with disease in communal living arrangements. Okay, and can be more severe, according to the health department statement. So they're saying at this facility, it says 70 nurses work at this particular nursing and rehabilitation center. Wow. I mean, this is the first I've heard this. I don't even recall seeing it because I briefly looked at the newspaper and I didn't see this in there at all. So this is definitely very interesting. So I'm just trying to look at what the symptoms are, and they're saying this adenovirus produce influenza-like illnesses with a cough and runny nose and feeling crummy. Oh, they did write that. But you get better. Okay, Dr. William Schaffner, an infectious disease specialist at Vanderbilt University, previously told CNN. But they can also, so they're saying that these kids can actually get worse with children with diarrhea. In rare cases among people with weakened immune systems, the viruses may cause pneumonia or inflammation of the brain and the tissues around it. In extremely unusual cases of adenovirus infection could result in death. Well, there's been 6. That said, most adenovirus infections are mild, with symptoms usually lasting about 10 days, according to the CDC. And for most patients, home remedies and over-the-counter medicines to relieve the symptoms will be the only treatment necessary. Adenovirus, unlike the flu, are not seasonal and can cause illness throughout the year. And while an adenovirus vaccine exists, it's only available to military recruits. The virus themselves are also resistant to many common disinfectants and can remain infectious for long periods on environmental surfaces and medical instruments, the CDC says. Wow. Okay, so they're saying it spreads by coughing and sneezing, direct contact with an infected person, or touching objects and surfaces, such as door handles and light switches, where adenoviruses can live and remain infectious for days or weeks. Adenoviruses can stay stable at room temperature for weeks or unclean surfaces, according to Dr. Alex, director of clinical. All right, I'm just going to go down a little bit. I don't need to know about their titles here. Washing your hands frequently and avoid touching your face. She previously told CNN that kind of, it's the easiest way of preventing and transporting something from your fingers into your nose or mouth. Endovirus infections usually occur sporadically. Here a case, there a case, so outbreaks are pretty rare. From 2003 through 2016, the most commonly reported adenovirus types in the US were type 2 and type 3. Through 4 additional types, 1, 4, 7, and 14. Wow. Also causes illness, according to a 2017 report from the National Center for Immunization and Respiratory Disease of the CDC. These 6 types accounted for 85.5% of 1,497 laboratory-confirmed specimens reported during the time period. This small number of cases is believed to be underrepresented of the actual number of cases due to the fact that most people who become sick either do not go to a doctor or their doctor do not test for this virus. And they're saying actually this particular virus is still very difficult to diagnose since they're not typically included in a panel of tests used to identify specific diseases or viruses, according to Shatner. He said the changing, and for that reason, he believes the number of cases will rise. So they expect this thing to get worse. Wow. Okay, so, wow. Let's see if more kids are impacted by this. But that's scary. So 6 children dead, 12 are ill with this virus. So, I mean, it didn't say anything about it being anywhere else. It just seems to be isolated to this one particular facility. But please tell me what you think, ladies and gentlemen. It seems like these illnesses are coming so fast, you can hardly keep up. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.